So in this video, I'm going to teach you exactly what is required for you to get pregnant. If you see this diagram over here, this is a diagram of how the uterus looks inside. This is the vagina. This is just like it's like a sagittal view. When we cut the human body in half, how it will look. So if we cut the uterus half, how it will look from the front. So this is the vagina. This is not how it looks from the side view, okay? But understand this organ's anatomy. This is how the uterus is, where the baby is going to be implanted. This is the vagina where the penis comes in. So when we are having penetrative sex, the penis comes in here and the sperms are released here. That's it. This organ is tightly closed. So this is like a very important thing that you need to know. This is the cervix, or the neck of the womb. Because most people will think that during pregnancy, if you have a sex, something bad will happen to the baby because then the penis will harm the baby or something. No, the baby will be implanted here. So this organ is always going to be tightly closed. So this is a cervix. It literally, you see this much, this is like 1 mm gap. This opens only during period time or during ovulation. When the egg is ready over here, it opens slightly, and there is a mucus plug here which becomes thin, so the sperms can enter inside. And it also opens during labor and delivery when the baby is coming out, and that's why it's so painful, because this organ is not supposed to be open. So it's a very delicate and tightly closed organ. This is the uterus body. This is the endometrial lining. This lining you see. So this is the lining which thickens every month. This is the bed in which the baby is going to implant. So this is the lining which will thicken every month. Like when the period comes, this lining has crashed, as in it's literally like a lace ripped off and the period comes. When the baby has not come and the period has happened, it will start again building the bed so that the baby implants. So it will start becoming thick. So at the beginning of the period is barely like 1 or 2 mm or 3 mm, but over the 1 month or 28 days, it will become almost as thick as 7-8 mm, or even thicker, like 12 mm if there is a pregnancy. And it just like the baby will start implanting only here in the endometrial lining, and then it will grow here for 9 months. Now the uterus, the baby should implant only in the body of the uterus, okay, only in this much area, literally here. If it implants here, it's a cervical pregnancy. If it implants here, it's an ectopic pregnancy, cornual ectopic. It can't grow here. If it implants here in the tube, it's an ectopic pregnancy. It can't grow here. If it implants here on the ovary, it's an ovarian pregnancy. So these are all abnormal places where the pregnancy can implant, which happens a lot when you take fertility treatment. And I will talk about it next time. But we want the baby to come and stick here, and that's the natural. If we don't touch you, if doctors don't touch you, the chances of you having an intrauterine pregnancy are very high. This is because you see the thickness of this wall. This uterus is a muscular bag. It's like a muscle bag. It just keeps growing and holding the baby. But you see how painful this place is. It's a very tight muscular. It cannot accommodate the baby. Even here, it's a narrow place. It will rupture. As the baby grows, it will break, and then it can cause internal bleeding, life-threatening internal bleeding. Even the tubes, these are even thinner. So here, if it implants and the baby starts growing here, it will rupture. Same on the ovary, highly vascular organ. So this is the uterus, right? And this is the tubes. So what happens now? The uterus is one responsible for the periods, right? Your menstrual cycle, every month, it's only this crashing. But this endometrial lining built up and crashing is dependent on ovulation. So normally we have one ovary here and one ovary here. They are not shown on this side. So one ovary here and one ovary here. So our ovaries, these are like actually only this much size, like 3 centimeter long. Okay, it's a white, pearly, nice, cute organ. And when we are born, we have around 4 million eggs. They're all immature. So these 4 million eggs are staying dormant inside. These, by the time we start producing, I think by the time we are born, when you are conceived, that time 4 million. By the time we are born, we just left with 1 million. And every month there are some dying, but they are like overall dormant. By the time we reach puberty, we have some 4 lakh eggs. So 4 million, 1 million, then 4 lakh only. So 4 lakh eggs remain, and then every month when we make one egg from 12 years of age, when our puberty starts, from that time, every time we make one egg, our 25 eggs die. So like that, slowly our egg reserve starts depleting over time, and by the time we reach menopause, we have very less eggs remaining. So this is the natural anatomy. Now every month when the period has come, that is the day 1 of your period, this endometrial lining has crashed. When this happens, our brain has another hormone called FSH, follicular stimulating hormones, that is going to start stimulating a follicle development here. Now the follicle is the egg here. There's a sort of like a cyst or a bubble in which the egg is going to grow and mature. So it will start growing. By around 13-14 day, it will become around 2 centimeter big, thick and tight, and that's when the luteinizing hormone comes, and that hormone will rupture it. When the egg is released, we release pheromones, which are like sex hormones, which the partner can sense. It's like we are in our mating season. So the husband will come. At the same time, the cervical mucus has become very thin, and it's very watery discharge. Not very watery, but slimy. So if you have sex during that time, when the egg releases, egg lives only 24 hours. So egg releases from here, the tube will go and catch it, and it will stay here 24 hours waiting for the sperm to come. If we have sex during that time, the sperms which are released here, they're very teeny tiny. Look at the size difference. They have to run all the way from here. It's a long journey. So they have to run all the way from here to here to here to here to here. And then they meet here. Like this, they will enter. It's a very thick, okay, it's not easy for the sperm to enter, but the fastest and the fittest sperm can only enter, and it enters, penetrates, and then the fertilization happens, and then it starts growing this way. You see, it was a 1 cell, then 2 cell, then zygote, then 8 cell, morula, blastocyst, and when it's around, I think 5-6 days later, then it will come and stick here, and then it will start growing here for 9 months. Our brain will get a signal, she's pregnant, don't let her shed the period, so the period doesn't come, and it starts growing for 9 months here. So in the next video, I'm going to talk about what happens in PCOS.